It's our great pleasure to introduce our distinguished speaker, Dr. Shiho Oikawa, who has graciously accepted our invitation to share her expertise with us. Today's guest, Dr. Shiho Oikawa, is practicing and teaching Ayurveda to Japanese population since 2011 after finishing her BMS from the Jamnagar Institute of Gulab Korba Institute of Ayurveda. And she joined as assistant director at Nippon School of Ayurveda, Japan. And since that time, she was teaching and practicing for the Ayurveda for the Japanese population. Recently, this year, in 2025, she has founded her own institute named, that is the Dhanvantari Institute of Ayurveda, Japan. And her pursuit for the innovation and excellence has laid a groundbreaking experiments and discoveries in the Panchakarma. How I know that Shiho is like you student. She was a student in Jamnagar and she had a very good innovative mind for Panchakarma. She always, like I remember her one memory that she collected the madhu from the market, different types of madhu, and she started the experiment, like which madhu is better for bus. And then once she asked me, do you know Dr. Rajkala about this Taila Pariksha? I told I have not done it. We just read in the Rog Nidana. She started doing that. She collected the urine from the patient and she was doing the Taila Bindu Pariksha in the department. Then somebody told her, you go to the Rog Nidana lab. So that's how she has done experiments with Panchakarma. So among like Panchakarma, practicing Panchakarma from the India, I think Shiho is we should applaud that she is doing the Panchakarma practice in Japan. So welcome you, Shiho, to this platform. And it's a great pleasure to have you today for our students. Over to you, Shiho.
Thank you, ma'am. Thank you very much. So I was a student of Rajkala ma'am in 2015. So it was a great opportunity to learn from Dr. Rajkala ma'am because of my practical, the pursuit to practically study Ayurveda, practically study Panchakarma because of Rajkala ma'am. She was the most active doctor and a teacher for us. And she always push us to do it. Just don't only think, don't only wondering. You just try to the patient and be sincere to the patient in front of you. So that was initiative for me to study Ayurveda, not only the sloka, but more practical way. So I'm going to share my slide. I'm trying to share my experience, and because academic-wise, you people who ever watching and listening this lecture, you people are much better than me, theoretically, academically. But I'm very poor in the sloka and Sanskrit and Indian culture. Still, what I am very good about is what Dr. Rajkala told me, practical aspect of Ayurveda, especially in Panchakarma. So I'm going to share some of my experience in this since 13 years. So the practicing the basics of Panchakarma, because basic is most important. We always wanted to do some big show, big Vamana, big Virechan, how many Vega we achieved, Sati Vega, Uttama Vega. It doesn't matter how much Vega you achieved. How should the patient get? That is more important. Then Panchakarma is not like a independent subject as Ashtabhida, the 8th branch of Ayurveda. There is no Panchakarma department about that. But each, like Kaya Chikitsa, gynecology, pediatrics, and Sharia, any department, they need us. They need the Panchakarma. So that we have to know the much more basic. We have to know the more basic, we have to know more than basic principle people. That's what I think. Who practice Panchakarma better, those people need more basics very, very well. So that the approach to the Japanese people, They need Ayurveda, especially Panchakarma, not only the illness, but for the detoxification and more health improvement. So what I have been doing these 13 years, I'm going to share with you people. So what about Ayurveda in Japan is this man is no more, Dr. Hatai. He was passed away 15 years back. So 1986, he started his own clinic in Japan. So for the information, in Japan, medicine means only the modern medicine. Government is not recognize Ayurveda as a medicine. We have a modern medicine and some of the Chinese medicine, but little bit. And also acupuncture and some good massage, but it's not counted as a medicine. Modern medicine is the only one solution for the most of the Japanese people. And also Japanese people, everybody has a health insurance. So that if we go to the hospital, any expensive treatment, expensive investigation, we pay only 30% of the whole amount. So the modern treatment is very cheap in Japan. So almost I think 90% of the Japanese population is not wishing to take any other treatment than modern treatment. That is the Japanese situation now. So in that situation, in 1986, Dr. Hatai, he started Ayurveda clinic in Tokyo. So now he passed away, but still his discipline, his disciple, they still continue this clinic. So I'm working in his clinic since 13 years, but he passed away 15 years back. So I joined 13 years back. So I met him only twice in my life. Still, I try to receive his spirit to my heart to practice Ayurveda to the Japanese population with modern doctors. So in this clinic, we have one good modern doctor who understood Ayurveda, and he also practiced modern medicine, and the 3 modern nurses and the 6 Ayurvedic therapists. We all together have a good team to practice Ayurveda here. So the big difference in practicing Ayurveda in Japan and India. So consultation, 1 hour. We take 1 hour to give a consultation to get to know the more patient. Because I was in the 2015 till 2018, I was Jamnagar, M.D, Panchakarma department. So there we are very busy. In the morning time, sometimes 120 patient is coming to get some medicine, and so the big table and maybe 6 to 7 Ayurveda doctors sitting around the one big table. Then patient is putting our shots to doctor, I have a knee joint pain, please give me some Yogaraja Gugu or something. So we don't have much time to spend 1 hour and discuss how is your appetite, what is your favorite food, what kind of feeling you feel when you get up in the morning. This kind of conversation, we don't have much time. We have to be in hurry. So after we give the medicine, if we want to know more detail about this patient, we have to admit the patient to the IPD, and then we can spend more time. Afternoon, I sit in near to the patient bed, then I can talk more. So otherwise, Indian government, Ayurvedic setup, we don't have much time for 1 hour. But now in Japan, the patient want to talk and I have to listen. And then during this conversation, I can get a lot of the information about Prakriti, Vikriti, Bala, Sara, etc., etc. So the consultation 1 hour is actually not so long duration, it's kind of short, but we do. Then prescription is not only the medication, not only Aushadha, Ahara, Vihara is same weight importance than medicine. Sometimes medicine is not working. If we prescribe a lot of the Ayurvedic medication, this medicine become armor only. So this will not be digested because the liver is a seat of the Bhutagni. So if liver is very tired, any medication will not work. That's what Dr. Rajkara told me that in the beginning of this session. I found that a lot of this Mutra Pariksha, Thaira Bindu Mutra Pariksha, many of the urine show this very interesting, the many pattern in in the surface of the urine. If I have more time, I want to share this information too. It was very interesting. So that especially Rasa Oshada department, those patients showing this Mutra Pariksha in the same pattern. So that was I found some interesting things. So which means the Rasa Oshada is somewhat make liver tired. So this tired liver is producing such kind of urine. I found that. So the many patient. So we also give Aushada means Avareha, Asavarishta, tablet, not Kashaya. Kashaya is not favorite to the Japanese patient, but Gurika, Churna, and many Taila. We are making Trifarathaira, we are making Dashamura Taira for giving this Bahya Snehan, Abhyanga. Also some Tikta Gruta for the oral intake we are making by ourselves. Then prescribing that kind of medicine. But along with medicine, Ahara Vihara is very important. So if the patient follow this lifestyle prescription, I give always in the end of the consultation. If the patient follow nicely, sometimes some patient is follow much better than my prescription. They found this way is much more better. So I just started tongue scraping and gandouche by themselves. Then they get better and they come back. So the prescription, not only the medicine, Ahara Vihara is very important. So then also some of the Japanese patients already they have been taking modern treatment. Those patients, maybe some of the Ayurvedic medicine is contraindicated, but Ahara Vihara, modern doctor never prescribe. So we can give some tip to this kind of heavy modern treated patient also. Then in Japan, the common complaint is infertility. Like about 35 to 45, many female patients and sometimes male patients is coming for the infertility treatment. So it's not only Ayurvedic infertility treatment, they are taking modern treatment, very advanced technological infertility treatment along with Abhyanga, along with Ahara Vihara. Many successful cases we have. And depression, heavy depression and light depression, but any depression. And skin ailment is also increased. And musculoskeletal ailment and autoimmune illness also. So my MD topic was rheumatoid arthritis, more like armor word. So that I like that autoimmune illness as a concept and how the modern medicine, the line of the treatment in the modern medicine toward autoimmune disease and the Ayurvedic treatment is very different. So that's also very important and interesting part. And also just like a health checkup, Ayurvedic way. So now I'm good, but in the future, what kind of illness I'm prone to, what kind of the illness I am prone to, that the healthy people want to know. So I can tell those patients for that gastritis may develop after 1 year. So you have to be careful. This kind of checkup also we are providing. And so also cancer treatment, and they are taking modern cancer treatment. Along with modern treatment, we can provide some Ayurvedic medicine and treatment, or after surgery, after chemotherapy, we are giving Panchakarma also. This is in general what we are doing in Japan. So then also, since 16 years, we are doing Panchakarma camp near to the Mount Fuji. So we have this kind of big house. Inside the house, patients stay 8 days, 5 days, sometimes 9 days. They stay there and they take everyday basti treatment and Birachan with handmade medicated ghee. Because each patient is a different agni, different bala, different favorite food also. So we have to modify it. Otherwise, the Japanese patient will not take medicated ghee blindly. So also SSPS means Shastik Shari Pindasveda for 9 days. Some of the interesting case I will show afterwards. And Nasya treatment, Abhyanga, Shirodhara, Matravasi for 5 days. So around 15 patients, we stayed together in this big house. Then every day we are giving treatment. They stay in the same house same big house. So we provide the proper ahara too. So each patient, Brunhana or Rangan or Brusya, accordingly, we give some of the diet also. It's not only this pharmaceutical diet, it's very tasty and delicious food we are providing. So here, this patient is immediately after heart bypass surgery. So he just came from this operative theater, OP theater. Then he just joined in this Panchakarma camp. So this scar is still somewhat lymphatic, some liquid is oozed out. But every day we are giving this 9 days Sharipindas Veda along with the meat soup, like a goat, mansarasa. And then in the day one, he could not walk. He just walking with very slow. But after 9 days, he walked very fast and then very fit. The skin color also improved a lot. So in the end of this Panchakarma camp, he told me that anybody who take this bypass surgery have to take this kind of treatment. That's what he said. So this scar is now completely closed and he can walk now fit. And he take it, the blood vessel from this arm. So this scar also very well healed. Then he can move the hand and tingling sensation and burning sensation all gone. And just 9 days of Shastik Sharipindas Veda. So here we did 4 patient Virechan. So as a Panchakarma physician, maybe some Panchakarma physician love the Vamana. My senior student, my PG senior student, Dr. Sumed, he was doing like 100 Vamana patients. So I have been studying, very good to study with him. So maybe his favorite practice is Vamana. But for me, Virechan is my favorite. So that Virechan is not only giving the Virechana Aushada to give a lot of Vega. We have to prepare the patient step by step. You know, this slow step, one step. We develop the relation, the good bond with the patient. If you achieve the good bond with patient, the patient Vega will more. This is what I found in the MD, and still I am seeing to the Japanese patient. If you can trust the patient can trust you, then the Vega is coming more, and good Vega is coming, and good Shuddha also you can achieve. This is very interesting part of Ayurveda, I think. But so Deepanapachana part is very important. So don't skip Deepanapachana part casually, not like a Trikatu or Hingvashtaka 3 days and just jump into the Snehapan. You will not get good Samyak Snidakshan. So that I did some of the patients like 2 weeks or 1 month of the Brukshana treatment first, like give the patient to buttermilk, chas, along with Hingashtak Churna or Trikatu, and daytime they have to take hot water, make them more luksha, and give more Deepanapachana. Then only their body is like now the very dried sponge, like any sneha, they can suck like anything. So that prepare the patient body in such a way. Then we prepare the specific ghee to each patient, because the patient, in Japanese patient, they are not satmya to the ghee. Ghee is kind of asatmya to the Japanese people. So I have to make them like a feeling very special. Like this special ghee is made only for you. It's very special ghee. Smell, a very nice smell. So now you can try this special ghee. You know, the patient feeling is like, okay, this is special ghee prepared only for me. Now they are ready to take. So that each patient have a different ghee, very freshly prepared. So Amawata patient, Pipari Gurut, chronic atopic dermatitis, Tiktaka Guruta, that we also made. Because sometimes we import Tiktaka Guruta from India, but this ghee itself is already kind of bad smell. So this smell is increasing the pitta unnecessarily. It's not like we don't want to increase pitta. We want to just make snigger to the patient. So we prepare very good smell. This tiktaka ghee is good smell. And infertility patient that she was taking Parasalpis. And then delayed allergy. Delayed allergy means some patient is taking mango, immediately within 3 hours they start rashes. But sometimes delayed allergy patient is after 3 days the allergic reaction start. So the after 3 days patient don't remember what they have taken 3 days before. So it's very difficult to find out to which specific food item they are allergic to. So this patient was found out any non-fermented food is allergic to him. This is very, very rare and very interesting patient. So we made fermented butter. Then from that fermented butter, we made tiktaka gurta. This ghee, patient doesn't get any reaction. So we prepare 4 variety of this specific gurta for patient. You know, this kind of practice, why we do this much detail is because the basic of the Panchakarma is more important. That's what I'm thinking. So, role of Panchakarma, do you know this Charaka Chikitsa first, Rasayana chapter, Chikitsa second is a Vajikarana chapter. So basically, if you want to make a beautiful color of the cloth, you have to wash well first. Then after only clean clothes, then only you can put any brilliant color to this white cloth. So which means what the Panchakarma means. So for maybe it's not feeling good to hear if you people Panchakarma physician, but we are just like a dobiwala. We clean the people. We clean, washing, very hard washing. But you know, if you really clean your clothes, sometimes this oily things, specific detergent is needed. Sometimes you just make a dirt, specific other detergent is needed. So we need to know what kind of vikriti, what kind of armor, what kind of agony of this patient to make this kind of patient to what kind of dirt they have in their own dirt. So if you don't know what kind of dirt, how you select the proper detergent. So we have to know the detail about patient, and we have to know each pharmacological activity of the plants, atmosphere, time, season, and everything. After you clean the clothes very nicely, now you can dye the patient. You can dye the patient or you can dye the thread to make beautiful bandhani. This is Gujarat, no, only Gujarat, yeah, not only Jamnagar, but this is Gujarat textile bandhani, you know, which means Panchakarma is just a Purva karma of Rasayan or Vajikaran or making Rasayana Aushada. For that, Panchakarma is basic of the all Ayurvedic treatment. So the Panchakarma physician need to know more basic, not in the advanced, but basic. If you practice basic very well, it's already very advanced. That's what my point is. So Purva karma is Panchakarma. So Panchakarma is not only the Vamana or a lot of Vega. After that, how you treat the patient. Now the patient is very white, clean. If you give the patient to just like a routine lifestyle, they get dirt, they get more worst condition before the Panchakarma treatment. After Panchakarma is more important, what kind of the lifestyle, Rasayan, Vajikaran, what is the target of this each patient life is. That's what you have to follow the patient. Then Paschat karma is patya, hita, dinacharya, rutucharya, just to keep the beautiful clothes, good maintain, that is needed. So what I practice in Japan is not exactly same like practice in India. So India, Japan, many people may not have came to Japan. I hope one day, please visit Japan. Please visit Dhanvantari Institute of Ayurveda. So there's a very good Japanese Ayurveda scholar here. So, but what is common in India and Japan is So the most of the patient is not treatment naive patient, which means treatment naive means not taking any treatment before. But Ayurveda, the patient comes just like a last solution. After taking overdose of the modern medication, then still not working, then they came to their mind, okay, let's try Ayurveda. So the patient is Prakriti and Vikriti and a lot of modern medication and a lot of the complication and side effect, then come to you. What to do? So if they come naive patient, if they are coming in the beginning of the illness started, we could treat better, but now more complicated. So this happened in India and Japan. This is a common things. And the line of the treatment is not start from Trikatu or start from Deepan Pachan, start always Nidana Parivarjan. What is the cause? What is the cause of this cough? Because of patient smoking, that's why they are coughing. You should not give this just like a Vasa Avareha or Vasa Arishta to stop make breathe, difficulty breathe, but they have to stop the smoking. You know that we have to find out the Nidana. And look at the patient, because I'm taking 1 hour consultation, this 1 hour, I can find out this Dashavida Pariksha, the Prakriti, Vikriti, and again, important is if we really know that what is Prakriti and what is Vikriti is, because the patient in front of you is already patient, the full of the Vikriti, Vata Pitta Kapha. So, but remove the Vata Pitta Kapha, Vikriti Vata Pitta Kapha, then find out what is a beautiful Prakriti part of this each patient. Many of us is not differentiating the Prakriti and Vikriti properly. We have to study and research about this area very well. And Sara, Sanhanana, Pramana, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, Vaya. This is like a specific terminology. When we are BMS student or MD student, we have to remember for the exam purpose. But if you really want to treat the patient, really want to know the patient in front of you, you need to know in each topics very well. So my experience in India as a doctor in 2015 to 2018, 3 years in the Panchakarma department in Jamnagar. So there, most of the patient is Indian patient, but sometimes Russian patient, American patient, Brazilian, Japanese, they are coming. So my experience there for around 90% is Indian patient. So what is the Indian patient characteristics is diet. In Jamnagar, most of the patient is vegetarian. So they don't eat meat, they don't eat fish. And the variety of the dairy products, most of the Indian people are taking milk, chai, dahi, chas, paneer, the many, what was that very sweet, hard yogurt, like I don't remember that most of the people liked. And also that I remember that many sweet shop, some of them I love very much, that many milk products are taking. Not lassi. What was that? Shrikant, gulab jamun is not a dairy. Shrikant, makam, yeah, see, but still there is much more variety. So that Japanese people don't take much milk product. Yeah, Shrikant, yeah, that's what. And the diet is not for the enjoyment for the Indian people. Sometimes this is a part of their discipline. The food is not for the enjoyment. Sometimes they are disciplined. They have to stick with one variety of the food. This is also nidana of decreasing ojas. The ojas if you have to eat variety of the food, is more ojas will be increased. That's what written. And fat is taking more oily content is more, because the vegetarian people, non-vegetarian people, fish and meat contain a lot of the oils. But if you are vegetarian, You don't eat meat and fish from where you can get the oil. Even though you are taking a lot of the beans make you a lot of luksha, so you have to take a lot of oil. So the desha and lifestyle, staying up late and taking nap is common in Jamnagar. Most of the people sleep in the daytime after lunch. Some of my teacher after afternoon lecture they come with hair stick because they might sleep after lunch. This is a common lifestyle in Jamnagar, and Jamnagar was very dry, and there's a many variety of the lifestyle. So, but personality of Jamnagar was like an ideology, limited food item, because I can eat only potato, I can eat only chapati, I cannot eat naan, I can eat only chapati. Very restricted food items, and no pork. Some of the Muslim people eat meat, but no pork, and various standard. And what is right? The in India, this is the Indian people lecture for the Indian people. I should not say that, but be honest myself. There is many variety of religion. That this part of the people think this is a light, then other people think this is the light. There's confliction. This kind of stressful life is how happen in India. This is a variety of the Indian people's characteristics. So, but in Japan, I was practicing since 2011 actually. So the Japanese people, 90% is Japanese people at HATAI clinic. But sometimes Indian people live in Tokyo. They come to me. Canadian, American, Pakistan people also coming to me. But the characteristics of Japanese patient is wide variety of the diet. They eat pasta, they eat pizza, they eat Indian food, they eat Thai food, and they eat fish, meat, many variety of vegetable, many variety of rice. This is very difficult to find out what kind of guna in their life, their diet. And eating habit is very frequent because there is many good restaurant and convenience store. We can get the food very easily. So they always eat. So Agni is always disturbed. Then frequency of the fish and the wheat allergy is more. And large portion at night. So the Japanese people eat a lot in the night, not in the lunch, eat at night in the dinner. So the Desha lifestyle is Japanese people sleep very less time. 1 o'clock in the night and 5 o'clock they wake up in the morning. So always very exhausted and habitually high stress. They work so too hard. They don't have much holiday. Excessive work, and still people are very kind. They always consider what others think about. So this is very sensitive. They are very sensitive. The land is not dry, marshy land. And ideology is overly sensitive, what I think is. Too much think about nothing happen, still they think too much. Then also, then they always wanted to be good person. That also their problem. They are already good, but they want to be more good. That is their problem. So the typical diet of Gujarati people. So the breakfast, gatia, fafda, and chai. I miss those food. I love that. Gatia, fafda, and chai. It's very tasty. So, and routinely, every day, 5 to 7 cup of chai they are taking. And Gujarati thali and the dahi at lunch. And then khichdi and the milk. And the dinner. This is the virudahara, salty food and milk. And heavy food, and after heavy food they sleep. And typical diet in Japanese food is looks like that. The center red and orange color is a fish. So sorry. So green tea, coffee, same as lunch. And we always eat this kind of sticky rice and soup and more vegetable. We eat fish, but other than fish, all are vegetable. So this is Japanese people food. So the Japanese people, this is lagu. But for the Indian people, if they eat this, this is very heavy to digest for them. This opposite, vice versa too. So now I want you to imagine, let us assume that if no one knows the word Ayurveda around you, if you don't have any Ayurvedic herbs in your hand, if your government does not recognize Ayurveda as a medicine, which is my situation, in such world, your degree may be meaningless. I am BMS, but no meaning. But you know the concept of Ayurveda and the beauty of Ayurveda, what you should do. This is my question to you people. If you have some idea, please share what you should do. Anybody? Hmm?
I want to. I will practice. I will practice Ayurveda only.
Hmm?
We have the knowledge. We can practice.
Yeah. You have a knowledge. But now I want to tell this doctor, we are doctor. So in India, doctor means something. You are doctor. But even Charaka said, doctor means one of the four pillars of the successful treatment. Only one pillar. We are the only one pillar. We need a medication, but medication means not only herbs. You have a ahara, vihara, patya, apatya. Your nice joke make good medication. You are patting your nice hand, patting the patient back, also good medication and good attendant. And the patient, you have to educate the patient nice way, not like hitting and follow my advice, not like that. But the patient themselves, want to follow your advice. This kind of teamwork you need. So the cure of the disease, we are four pillar. For the target is cure of the disease. The physician, medication, attendant, patient. The same kind of the example Acharaka is giving. I love this kind of many example that our classic is giving, keep on giving. So we should not skip just one of the example. Don't think just example. There might be more big, deep meaning in that. The food preparation, you are the chef, but you are the chef alone in the kitchen. There is no gas, there is no vessel, no fuel, fire. You are the chef, but then what? You cannot make anything. You need a fire, fuel, vessel. So I think this vessel means the patient, and attendant means the fuel. If you have some other idea, you just implement in that. Pottery, you need a pot. You are the potter, but you don't have a thread. You don't have a wheel. You don't have mud. You cannot do anything. So that we may be good physician, love Ayurveda, good knowledge, but you need a team. You need a good company to practice your knowledge. So the victory is you are the general, but no weapon, no army, no any topographical position. You are nobody. So you need a good team. You have to be good person to make a good team. So my point is, you can do many things, but not on alone. You have to make a good team. Good team make you do anything. That is sure. So to understand the Prakriti, my little point is, understand the world is very colorful. That is needed. For example, this five person, this four lady, one boy in the middle, this is what you call quinta plate. Not the twin, not triplet, quintuplet. So zygote happen at the same time, same condition, but this kind of variety of the people. So now, how you understand the Prakriti, the concept behind what make this kind of difference in these people independent. So the three dosha is combination of three color, like a three primary colors. Combination of the cyan is kind of blue, yellow, and magenta is kind of red. These three color can make world very. This all color around you is made by this three color only. So the same way, Vata Pitta Kapha can make this kind of many variety of the people, so that we have to enjoy the colorfulness of this each patient. So if you start enjoying the colorfulness of the each patient, you may start enjoying this diagnosis of the Prakriti of the patient. So this is case, Japanese case. Her job is a gynecologist and very hard worker, and the three children. So her occupation is gynecologist along with mother. Mother is very hard occupation. Personality cheerful, kind, and love the joke, and very, eager to know the many information. And treatment past history. So she is not a treatment naive patient. Already 2 years of the topical application of steroid has been done. So, but the most left one is her condition. But 1 year she got better in such like this. So in this Shatkriyakara wise, I was rethink about Sanchaya Plakopa is overwork. She like deep fried food, irregular meal time, because very busy daily schedule. She can fix the lunch time. So when she have a 5 minutes, 10 minutes, she eat pop in the mouth, then they start working. Lack of sleep because she go back to the home. She have to take care of the three children. And the postpartum is also a lot of the Vata Prakopa, but she could not take care much about this Vata Prakopa. And so the tissue damaged. So that continue going on. So the Nidana leads to aggravation of Tridosha. Now start to spread to the skin, localized at the skin tissue. Now Sthana Sanshraya happened. Then next stage it become Vyakta, which is psoriasis. So she came us after 2 years. She was treated with Ayurveda for 1 year. And this is her leg, and this is her back. Now the case in India, how can we contact you? No, later, yeah. So the case in India, this is 2016 or 15 or 16. That's a very old picture. So his occupation is Baba. So the personality is very devoted. He's very devoted. I was enjoying to spending time with him in the evening after my all duty done. I visit him and I listen and I ask how become you Baba, this kind of story. He was happy to tell. Follow the rule according to his own. That is important. His own. It's not like Indian government. It's not like a hospital rule. His own rule. But he is very devotedly following his own rule. So he is honest. So past treatment history, application of the ashes from the burning holy object. This is also very important and interesting. Ashes means Basma treatment he has been taking. So, but it's not showing much good result. And Sanchaya and Prakopa habitually consuming milk and the fruits for the dinner for the past 15 years. So again, this is a Viruddhahara. And spend the whole year wearing this orange piece of the cloth, very cold, very hot. So he wear this cloth, and living in the ashram lifestyle centered on the asceticism. So he is very sincerely following. He is not consider his health condition. But after this changing, can you see this redness to become flattened? It's not, we are planning to give Virejan to him, but after proper Dipanapachan and the Snehapana, only the end of the Snehapana, already skin rash is gone. So this is Snehapana is giving the Agni Dipan. That's what I think. I don't know. What do you think? I want to discuss, but I will discuss Dr. Rajkar Ma'am later. So, but anyhow, our ultimate goal is not treating the patient. The physically treating the patient means dhatu samyata, it's for sure. But psychosomatically, we have to support the patient to achieve dharma, artha, kama. So if the patient is getting good health, but still many patient is not happy. Some patient is very happy, even though they are very difficult situation in the health-wise. So what is the difference? So without any sense of contraction, the patient need to achieve dharma, artha, kama. That's what we have to support and help. So the Charaka Sushruta 10th chapter, the 5th sloka, they are saying that that is a four pillar chapter. So that Atreya was talking, and four pillar is important, and four pillar, if you have four pillar of the treatment, patient get better. Then one of the discipline asking, even though four pillar is proper, that some patient is not recover. Why? So then he said, the patient may fall, the healthy person just fall, that fall patient can wake up alone by themselves. But if you help by giving the hand, patient get up more easier. That's only the treatment. It's not you are giving the treatment. That is my favorite sloka. So we are not treating. The treatment happen in the patient body. We are just supporting to get up. So we are not the one who are bringing the healing. It is the patient power to make them heal. So we, the doctor, just watch over them, support them, and accompany them to the end, overseeing the healing process. So let's take on your role sincerely. Your role means four pillar. One pillar is you. Other pillar, you have to take care. Other pillar too. So let's take on your role sincerely. In the end, that's all we can do. Other than that, we cannot do. We can do only one pillar job. Stick to the basic. Jai Ayurveda. Thank you very much. That's it, my presentation.
Thank you, Dr. Shiho.
Thank you very much, Dr. Rajkar Ma'am.
Really, it was really too practical for the students. They enjoyed.
Yeah.
The
Thank you, ma'am.
basic things you have explained.
Thank you.
On behalf of our department, I really thank you so much.
No, thank
And,
you, ma'am.
Yeah, it was really very nice. I also enjoyed it was very nice.
That's very happy. I wanted to see you personally in face to face, and I want to share many things, and you will teach me a lot. So
Yes.
I hope it will happen this year.
Yeah, sure. We'll meet. Yeah. Any,
wants to ask the question.
if anybody is having question online or students, they can ask to Shiho. Yeah. The one pillar she is struggling to establish in Japan. And really, your hard work, we can see it.
I'm
You are doing marvelous.
keep on doing the hard working. Just what you told me to do. Keep on doing.
Yeah. Kvachit dharma kvachit mat, this practice of Ayurveda or practice of Panchakarma will give you everything.
Mm-hmm.
That always,
This question.
yes.
That what you told me. That is you told me. You teach. You told.
No, it is what you have gained from the Jamnagar or from Ayurveda. It's all your benefit.
You showed me the way how you practice. You believe and you just do. That's what you told me. I just keep on doing what you have told.
Thank you, Shiho. I think there are the questions
Mm-hmm.
for you. The Gautam Gunde, he has asked, how is your dinacharya while observing the patient there? That is the question by Dr. Dinesh Gunde. How is your dinacharya? He's asking your routine while observing the patients there.
My dinacharya routine?
Yeah, because you were showing the Japanese routine, no?
Uh-huh.
So that's why he's asking your routine as Ayurveda.
So the wake up in early morning is make your body, generate the self-healing activity. If you wake up after 9 or 7, your self-generating program is deactivated. This is for sure. Now the modern people is find out genetically, if you wake up in early morning before sunrise, your body start generating, activating your natural healing processes. You know that now the you people feel like, oh, now I have to wake up in early morning. You feel like that, right? So I'm teaching this way to the patient. So the patient will start wake up in early morning. Then that way patient could not awake till the midnight. So that same day, patient may fall in sleep after 10 o'clock in the evening, so that a good cycle will start.
Hello, ma'am.
Hi.
Ma'am, you spoke about the Shodhana process, that medicated ghee used for Virechan procedures that are customized because of like smell and everything. Ma'am, I just wanted to ask, like the Shaman Aushadhiya. Shaman Aushadhis are also customized for every patient, or matlab, how it is practiced?
Shamana Oishadi, so the Snehapana for the Shamana purpose and the Utkresha purpose is different in the timing and the dose. Yeah. So the Utkresha purpose, we are giving much more quantity, Hrisiasi dose, and have to increase. That's why the ghee have to be very specific. But for the Shamana purpose, also we are making the ghee, but in the general. But the Virechan patient, we are making the ghee more special ghee. And we are making many other oil also because we trust the ingredients, but we don't know which kind of process is Snehapaka is properly done or not. That we have to make it sure. That's why we are making our own medicated oil also.
The next question is, what kind of herbs do you use there?
Okay. So what kind of herb? So I am working with modern doctor. So I can prescribe many Ayurvedic herbs, which is prohibited to selling in Japan, because some of the herbs is in Japanese government recognized as a medicine. So only the modern doctor can be sell and buy. So me, as an Ayurveda doctor in Japan, is not a doctor, is common people. So I cannot sell the medicated herbs. So, for example, Tulsi, Amarati, Brahmi, Shatavari, no problem. But Guduchi, Ashwagandha, Haritaki, these are prohibited. So that if the person personally wants to consume this kind of Ashwagandha, they can import by themselves, or I can prescribe under the name of the modern doctor. That is my trick.
So anyhow, you are practicing there.
Yeah,
That's the best part.
I am trying. Yeah.
So, okay, Dr. Shiho, you will conclude.
Thank you
for sharing your experiences.
Thank you very much for the opportunity. Yeah. I will call someday, and I want to discuss some research work with you, ma'am.
Yes, sure. Okay.
Okay.
Thank you so much.
Thank you very much.